Welcome to the latest in our series of Beyond the Expected, the Coronavirus Effect podcasts. In this special edition, we'll take a close-up look at the healthcare professionals who are on the front lines every day caring for patients in this great crisis. We'll talk to two of our doctors who contracted COVID-19 but are thankfully well on the road to recovery. And we'll also talk to an epidemiologist who has an insider's view on the hospital incident command system. In addition to that expert's view on what we can all do to protect ourselves as patients, providers, or as healthy individuals, as the recent surge in cases continues to challenge all of us here in New York. Let me introduce our three guests who have a unique inside perspective on all of this. I'll introduce myself. I'm Michael Bernstein, the interim president here at Stony Brook University. Very grateful to have the participation of our three colleagues today. We have Dr. Susan Donnellan, who has dedicated her career to studying infectious disease and epidemic pandemic preparedness and has made and shared impressive breakthroughs in this field. She developed an Ebola care plan that's adaptable for patients with other diseases, and she has certified training in pandemic planning and preparedness. She wrote a bioterrorism preparedness program plan for Stony Brook University Hospital. In addition to so many other roles in the critically important field of telehealth, another guest, Dr. Kimberly Noel, serves as Director of Stony Brook Medicine Telehealth, as well as Deputy Chief Medical Information Officer for Stony Brook Medicine. Just as many of her telehealth initiatives were taking off, Dr. Noel contracted COVID-19 about 4.5 weeks ago. But she's with us today, fully recovered and symptom-free, and she'll share both her professional and personal insights and her strong passion for telehealth and why it's so critical today in the midst of this crisis. And finally, as manager of our surgical intensive care unit, Dr. James Voswinkel is incredibly knowledgeable and experienced in all aspects of trauma care. This expertise, of course, is being called into action now like never before. Vos, as he's known to us, has been right on the front lines providing care for patients with the most severe cases of the coronavirus, as well as acting behind the scenes to help ensure we have the capacity and equipment we need to address the patient surge, including directing the setup of additional ICU, intensive care unit capacity. Like Kimberly, Vos will share with us what it felt like to contract COVID-19, as well as what he's been doing to keep our ICUs fit for purposes under the most challenging of circumstances. I want to thank all three of you for being with us here today, and let me start with Vos. According to your colleagues in the emergency department who reported this in the New England Journal of Medicine this past week, the first so-called PUI, person under investigation, was seen in the Stony Brook ER on February 7th. Since then, 3,500 patients have come through our emergency department. Why don't you take us back to February 7th and give us a sense of what it was like in the early days of this COVID-19 siege and how it's evolved since here at Stony Brook.
Absolutely, Dr. Bernstein, and thank you for having us today. We do really appreciate it.
Thank you.
Back on February 7th, when it started to unfortunately be a concern in the area, I would probably say that's when we began our period of watchful waiting. You know, there was obviously concern that it could take hold in our area. At that point in time, the majority of cases and community spread are obviously outside of our country and around the world. Personally, about 2 weeks later, when we heard that community spread had started in Italy, I believe it was over a weekend when it went from about 3 patients to over 100, is I think when I became a little bit more concerned. Fortunately, we have such a great team here at Stony Brook that as things progressed, we put all sorts of special committees, emergency preparedness in place. So as the virus started hitting our area, we were ramping up our efforts to deal with it. So I think it was an incredible response. I think it was very heartfelt how the community has come around us. So as things have elevated up, you've seen how everyone has really stepped up to their best to really fight this disease.
Indeed. Let me just follow up on something you just said, Vos. So watching the numbers in Italy yourself,
correct,
that weekend when you saw the spike, from single digits to over 100, that was your moment of clarity, as we say, where you said, this is really a serious problem we have on our hands and we'd best get ready for it?
Correct. I was actually at the diner with my family on a Sunday morning, and they had CNN on, and it popped up, and that was when I got that that bad feeling in the stomach, like, okay, we have community spread definitely outside of China and other countries, and it's probably, unfortunately, really a matter of time before it happens here. So, that's when it hit home more for me personally. Fortunately, as I said, our institute was prepared. It stepped up in a proportional fashion as the disease progressed, and we've provided a very high level of care throughout.
It's prescient on your part in that diner too, because we now know that a big part of the vectors here in the States came from Europe, not from Asia, right?
Correct. Absolutely.
That's really striking. So let me ask you directly, when did you realize that or suspected that you had contracted COVID yourself? Were you experiencing the same kind of symptoms we read about in the news? Was it something unique? I know our listeners and viewers want to hear about your experience in this regard.
Absolutely. So it was really 3.5 weeks ago. It was Friday night when I had gotten home, and I started with the dry cough. I had a headache previous 2 days, but as busy as you are, a headache is obviously common. After the dry cough, by about 2 or 3 o'clock in the morning, I started with the typical body aches, and right there, obviously, my concern went up. Took my temperature multiple times throughout that night. In the morning, I was fine. It wasn't until the next day that I started to get a low-grade temp. At that point in time, I was fortunate. I came over to our PLOT. I was tested. I stayed with the malaise and the fever throughout that next 24 hours, and then I got a call from the Department of Health that Sunday afternoon that I was positive.
Just to remind our listeners and viewers, we have a testing facility at our so-called P-lot, the big parking lot on the south side of the campus. So you had gone there to get your initial
Correct.
test.
And listen, as being a patient in there, I can tell you the setup is top notch. It's an outstanding resource for our community as well as individuals. It is done very professionally, very expeditiously, and I found it, obviously in a very unfortunate time, to be a very reassuring resource how quickly things were processed and went through.
So you got the news from the Department of Health, and then what happened?
Then I returned to our emergency department. I had all the appropriate lab work done, and the workup from that perspective. Over the next probably about 3 to 4 days, my fever abated, the aches persisted and got somewhat better. And then, unfortunately, somewhat classically, around day 7 is when sort of the bottom fell out a little bit. My predominant symptoms at that point in time were just very heavy malaise, body aches, to the point you really sort of couldn't get out of bed, that your typical pain relievers, such as acetaminophen being Tylenol, really weren't relieving them. Several days later, the shortness of breath kicked in, along with the malaise. I had some GI symptomatology throughout. I believe actually several days earlier than that, I lost my sense of smell. So I kind of followed the whole textbook case.
Sort of the standard what we're reading about in the press.
Correct, I did. And I was I was fortunate. As I said, I did a lot of good things, obviously being a caregiver throughout, knowing what to do, keeping ourselves hydrated, using zinc and vitamins, making sure I walked around, positioning myself. I had picked up a finger pulse oximeter, and I was able to take my oxygen levels throughout and know, even though I was short of breath, that my oxygen supply was good to my body, the amount of oxygen I was getting. And obviously, as I said, I was able to stay at home. Right. I did unfortunately give it to my entire family, which was, really nothing I intended to do, despite trying to take the appropriate precautions. My children did, well with a mild course. My wife had a course for about 6 days. So we really did fall into the appropriate demographics of my 13-year-old, 15-year-old, and 17-year-old having very mild courses. My wife, who's my age, having a milder course than me, and myself being probably a little middle-aged hypertensive, which is a comorbidity associated with, more severe disease, having more of a higher disease level.
And if I'm remembering correctly, at least the reports have indicated men are struggling more proportionately than women with this?
Correct. So it really did hit me how the demographics show, as I said. But doing things at home, walking around, laying on my abdomen sometime, called prone positioning, keeping myself hydrated, even eating when I didn't want to, making sure I got some
Right.
protein into
Right.
me.
Right.
Those are the advice I would give people at home because, those basic type things go very, very far with this virus.
Well, needless to say, a blessing that you and all of your loved ones are now safe and well. Dr. Noel, you too came down with the coronavirus, so why don't we bring you into the conversation? Why don't you tell us about your experience? Then I have a question for both of you and a follow-up, but please share your story with us.
Sure. Just as Voss had mentioned, in terms of original presentation, I really started feeling muscle aches and chills, which was not at the time really recognized. I was, working in employee health. We were counseling a lot of employees to look for fever, shortness of breath, cough. I never manifested cough. It was actually a Monday that we run our monthly telehealth work group, which is a quite large consortium of stakeholders that, deliberate on how we're going to roll out telehealth. We had this large virtual meeting, and right after the meeting, I just felt this wave of just fatigue and chills. And if there are other doctors or clinicians who are out there, doctors make the worst patients, right? We're pretty tough and not wanting to admit that potentially, we're susceptible like other people. And so I knew I had to self-isolate, but I hadn't manifested fever. And so thankfully we were doing all of our work remotely. But that night, it was just really impossible for me not to lie down. I was still typing on my computer. We're planning for a rapid surge of telehealth, still making my meetings, but it was harder and harder for me to function. Yeah. And so the very next day, I was able to get tested, and, it took a while. It took about 7 days for me to get my results.
To get the results.
But I knew that I had to isolate. And so I was able to stay home and stay safe, and thank God, didn't require any hospitalization. I really was just, again, trying to take advantage of supportive therapy, vitamins, hydration. But I think that my course was really prolonged because I wasn't resting. So it took me about a good 2 weeks to become asymptomatic, where I could then re-engage with the outside world.
Return fully.
Yeah.
It's so glad you've recovered. So you've alluded to something I wanted to ask you, and I'll also ask Voss to chip in. Is it true that, in fact, you physicians are the worst patients, and why is that?
We are. Well, I also blame it on being a man because, we ignore everything.
Yeah, men are terrible patients.
Absolutely. So
Yeah.
I got 2 strikes against me to start.
We're all babies.
Obviously, it's never good. Is it that we know too much and we have a fear? Is it we tend to ignore things? Is it whatever it may be? But I would say in general we do. We're not necessarily the best patients. So from that perspective, as I said, this is something that I advise all healthcare professionals, everybody, to obviously take seriously. It's something that if you manage it right, and with our healthcare system in place, functioning as well as it is, we will get people through this. So if you do notice the symptoms, please, take them seriously.
Dr. Noel, would you agree?
Yeah, I think there's not a time to be tough in that you ignore symptoms. I think it's completely appropriate to reach out, especially if you're having a hard time dealing with symptoms emotionally. I think that doctors do interface with some of the most severe cases, and not all of these cases are severe. So I was very reassured. There is the curse of knowing too much.
Right.
And but on the other hand, I knew also the CDC guidelines and that I had to check my temperature, and it was really the temperature, my high fever, that made me eligible to get tested at the time. And so I think we do follow the rules, but we're not always easily able to rest and step back.
So let me draw you, Dr. Noel, into some comments about your professional role. You have been one of the leaders, advocates, innovators in the telehealth field for Stony Brook well before this emergency, descended upon us. Now, of course, with the pandemic upon us. There's been a huge surge in activity in the telehealth arena. Why don't you tell us a little bit about your experience with that? This is something you've been advocating about and leading about for so long, and then suddenly you're at the, if you will, you're at the bow of the ship, leading us in this transformation of healthcare.
Absolutely. I mean, no one could have done the job better than coronavirus in prioritizing digital innovation. Medicine suffers about 17 years lag in terms of technology and adoption of, best practices in terms of tech. And when we face a pandemic, we realize how important it is to catch up to the rest of the world. And what we're accustomed to as consumers is not always the case when we have to mobilize resources quickly in the public health sector and in hospital systems. So I think we now understand the value of telehealth and remote patient monitoring, and there's more work to be done. I believe that just the fact that we have bipartisan support at this time to roll through these, congressional and then Senate and then signing into law, telehealth supporting funding and prioritizing this from a policy angle as well as seeing state support. There's not one person who does not see the value right now of telehealth. And now the case is to augment that, optimize that, and make sure that it sticks.
Right. Are there particular innovations or advancements that you think about now as being crucial in the context of this pandemic, or is it what you expected? Any surprises for you?
Absolutely. I think right now we have to think about our most frail community dwelling elders or persons with disabilities who are not easily able to manage video. We need more data oftentimes. A physical exam can include heart, evaluating, auscultating the heart, listening to heart sounds, lung sounds. These are things that can be done also digitally with remote patient monitoring and with advanced Bluetooth stethoscopes, for example. So the technology is out there, but the challenge now is to be able to get those technologies quickly enough and implement them into how we do, how we practice medicine.
Right. Last week we had a podcast with a couple of colleagues who were also in a very similar space. Catherine Duffy, who runs our so-called Healthier You program, Christy Golden, the Associate Director of Operations for Stony Brook Medicine, and Adam Gonzalez, the Director of Behavioral Health. We talked a lot in that podcast about telehealth, telemedicine. I'm curious what you are hearing. We talked a little bit about this last week too. What are you hearing from the community? What do you hear from your patients, as well as your colleagues about the, if you will, the pros and the cons, the good and the bad of telehealth?
Well, telehealth is an absolute need right now. So there are people who cannot see their doctor at all unless they get on video. So there is that sense of urgency, and patients expect the ability to be able to use these technologies. We do see a divide between people who are easily able to adopt to change and try new apps or new ways of doing things. But the sheer necessity has created a large group of fans. I think we still have work to do in terms of making it as seamless and easy as possible as other consumer experiences. That many people know how to just click and buy something on Amazon, but to be able to get your lab tests or be able to follow up on your important medical needs are still challenges that we're working hard to address every day.
Yeah, these are very important points. We think about this a lot at the university with respect to online instruction, about differential access to technology, to Wi-Fi networks, let alone equipment. I also was struck by your comment earlier that COVID-19 has done more than anything we can think of in propelling the digitization of our society, and it's made me reflect on we hear a lot about the incidence of the so-called Spanish flu after World War I. This was at an age where there were no digital platforms to communicate. So I wonder what that must have been like for communities forced to isolate to try and protect themselves from that terrible scourge. Of course, different communities, they obviously communicated in different ways and were used to different kinds of distancing and isolation than we are. But interesting comparison. Dr. Donnellan, let's bring you into the conversation. You're an epidemiologist and infectious disease specialist. People everywhere are striving to do their part in slowing and ultimately stopping the spread of this virus. What are the most important things you would call out for healthcare providers and for all of us to protect themselves and, most of all, to protect the people around us?
I think the things that we're doing right now, staying at home when we're supposed to, if we're not a critical or essential employee, we need to stay home. We need to isolate from others in our community, except for the most basic necessity in terms of having to go out for food or prescriptions. But we can minimize those number of trips by having some shelf-stable foods at home, having an adequate supply of prescription medication. When we do have to go out, it's important that we keep in mind that concept of social distancing. I know it's been a drum that's been beaten incessantly, but this is primarily a droplet spread disease, in which case you need to be within 6 feet of someone because the droplets will reach that far before they fall to the ground. It's important that at this point, if you are going out into places where you can't socially distance all the time, that you wear some sort of covering over your nose and mouth. It's a common misconception that covering is for your own protection. But in truth, it's really for protecting other people. You're trying to contain your droplets behind your nose and your mouth so that they don't get transmitted to someone else. And that really speaks to the possibility of someone being able to transmit the virus before they are overtly symptomatic or even mildly symptomatic. As we had talked about before, if someone coughs, we want them to cough into their elbow. All little kids know that. They've been teaching that in school forever, or at least into a tissue. Hand hygiene is so important before and after you prepare food, after you use your hands for coughing or sneezing. It's very important to take advantage of telehealth, as we were just discussing, and also delivery services. You don't have to go out for every single thing. So the basic things that sound so simple are really the ones that are the most impactful at this time.
Right. I want to return to your point about masks. Obviously, there's been a lot of discussion about masks the past couple of days, rumors that there will be orders regarding the wearing of masks, so on and so forth. But you've made an interesting point that wearing a mask is, in a way, signaling to others that you're concerned about their health by protecting them rather than the other way around.
That's exactly right.
What about other forms of protective, so-called personal protective equipment, PPE? I mean, do you think we're going to be headed toward even more stringent orders in that regard, or do you think that's basically a clinical issue?
In the hierarchy of infection control, PPE is the least important of the three administrative controls and engineering controls. PPE is the least important because it's the one that has to engage the user in the most consistent fashion. So when you go to grocery shopping, you see people wearing a mask and they're wearing gloves. The gloves are really, they think it's protecting themselves, but in fact they're touching everything with the gloves, sometimes touching their face with the gloves.
And that's a real problem.
And that's a real problem. And then they forget that gloves are allowed to have little holes in them, and they're not stainless steel. And so they're looking to the gloves as only being something that protects them, and then they forget that hand hygiene has such an important role in it. So just consistent hand hygiene is much more effective.
Much more important. Mm-hmm. So in fact, rather than wearing gloves at the grocery store, it's about using sanitizer when you touch something in the store, making sure, and not touching your face.
Not touching your face. That's probably one of the secondary gain of wearing a surgical mask or a face mask out in public, is that it does keep your hands off of your nose and your mouth. We do this all the time, people don't realize it. If you sit around in a meeting when all this is said and done, and you look around the room, there are lots of people that are adjusting their glasses, scratching their eyes,
Right.
rubbing their nose. We touch our faces all the time,
All
and
the time.
it's a very difficult
I've been
habit to
trying.
break.
I've noticed the past couple of just trying to remember to sneeze into or cough into my elbow rather than into my hand. My mother always taught me, cover your mouth with your hand when you cough. Right, that's the
That's
polite
true.
thing to do.
Yes.
She didn't say anything about elbows. She'd hit me with her elbow when I didn't cough into my hand. So let me ask you the proverbial $64 million question that we ask of any epidemiologist these days. Have we hit the plateau? What are the data telling you here on Long Island, here in New York State?
Well, I can speak for I know what's going on intimately at our own hospital. And first, I think before we talk about the plateau, I think a little bit more about the curve. People have seen the graphic where the epidemic curve is like that. And what we're trying to do is flatten the curve, understanding that it's stretching it out. So a plateau can actually be a more protracted or prolonged time of activity. But the idea is to try to mitigate the impact on the healthcare system by not overwhelming it. The other thing that I think is important for people to understand, like for example, we've been hovering around the same number of patients in the hospital over the last few days, but it's not a static concept. It's not if you plug a sink and plug the drain and fill the sink up halfway and then stop, the sink is half full. No water is leaving and no water is coming in. But in the case of healthcare, what's happening is, at least at this point, and we're fortunate that that's the case, it seems that we are discharging as many patients as we're actively admitting, which helps us to understand that there's still community spread going on. There's still illness that's occurring. It's just that we're at a balance at this point. And that's why it's so important to not pull back on the restrictive parameters that we have now about staying home, working from home, schooling from home, because when we start to loosen up those parameters, we may in fact see the plateau begin to rise again.
Right.
We should understand that a plateau or a peak is what I always call a rear view mirror phenomenon. You know that you're there when you've passed it
When
and
you've
you're
passed
starting
it.
to consistently go down.
That's right. Voss, let's draw you in here. I know that you're not quite back working full time at the hospital yet, but you're on your way there. Tell me about what you've been involved with and what you're seeing in terms of our managing our hospital and in particular our ICU capacity to meet these increasing challenges with respect to what we hope is the plateau, as Dr. Donelman says, that we're trying to manage.
Absolutely. So I have been one of the many people involved, obviously, in our whole surge plan and really readjusting how we've provided healthcare across the board to obviously accommodate the surge of COVID patients we've had. At the same time, obviously, still providing our, everyday services, being, OBGYN, trauma, cardiac, or whatever it is. One thing we did is we've almost tripled our ICU capacity, and we've done it in a relatively short time. We've done it with a lot of people involved, and we've done it in a very efficacious way. So as I mentioned earlier, we're still providing a high level of care. Despite my illness, I knew I couldn't be obviously at the hospital involving patient care, but I was at home. I was on multiple, Microsoft meetings and conference calls, really being one of the, per se, leaders in the ICU expansion to really develop everything else. And, to sort of reiterate something I can, it's really amazing how the entire Stony Brook team, as well as the whole healthcare team throughout our community and our country, have really come together where we have healthcare providers who aren't normally in, say, a medical subspecialty, who are contributing and providing care just for this virus outbreak.
And it's powerful to hear you say that. Can you also tell us a bit about the sharing of information and of best practices, not only among the Stony Brook Medicine team, but indeed across teams, other medical communities here in New York, or even nationally and globally?
Correct, and that's been also a very positive, incredible thing. All of your different societies. One of the main ones is Society of Critical Care Medicine, has really been very active in webcasts, recommendations, best practices. we've went as granular as we've actually been emailing people in China, intensivists in China, their experiences. We've reached out to Italy, South Korea, many other places. Various committees have been formed so that we have standardized guidelines. They've been led at a very high level in our hospital so that we are providing care across across the spectrum in a very consistent way. We've been more locally in touch with our partners in the city, whether it's Health and Human Services, whether it's Northwell, whether it's the Catholic Services, so that we are really trying to make sure that the best practices are disseminated. Any new therapies that are coming, that they're being integrated in after they're properly vetted. It's really been a Herculean task by so many people that it's great.
It's interesting to reflect on this. This digital world we live in has made it possible for us to socially separate and hopefully slow down the rate of infection. At the same time, it's facilitating literally at the speed of light the sharing of information and best practice around the world to get on top of this pandemic. I've also heard, we've heard about this in the news at other facilities, but I've heard at Stony Brook University Hospital, we are celebrating successful discharges, maybe with music and so forth. Is that true?
Correct. Correct. And I'll be quite honest with you. We are discharging people every day.
Yeah.
We are getting people off ventilators every day. And when we do that, it is tremendously uplifting, obviously not just for the patients and their families, but the staff.
Right.
It shows us that we are successfully fighting this virus, that we are making patients, even critically ill, gravely ill patients, that they are recovering from this. So we are disseminating every positive thing around. It does help, the staff as they're working extremely hard, know why they're working hard.
I think this is a very important point you are bringing up, that in the midst of this pandemic, I think the public are getting a sense of how important it is for the medical practitioners themselves to be able to celebrate success and to, understand the difference they're making. They're on the front lines. They're literally being traumatized themselves by these unbelievably difficult conditions. And I think that's one of the silver linings in this cloud, that people can appreciate that about the physicians, nurses, technicians, and teams in our hospitals and nursing homes and other health facilities for the, being celebrated for the incredible work they're doing. Is there anything I'm curious, is there anything in particular you've been hearing across these global digital networks that's been a revelation for us here at Stony Brook, things that colleagues have shared with you either from other parts of the country or around the world that have been uniquely helpful?
Absolutely. And I think we can break it down to so many multiple areas. So whether it's how we ventilate patients in different modalities, to what drugs we use, to honestly, even how you staff ICUs and you handle the expansion of patients, how we can integrate, as I said, services that normally don't provide these services or people that don't into this. So it's really been incredible how the resources are out there, and vice versa. We are contributing every day, and we're contributing our experiences and some of the things that we found to this pool to try to help everybody out. So it's definitely been a two-way street, and I think a lot of good stuff is coming out of Stony Brook itself to really help the healthcare community and the treatment of patients as our experience grows with the disease.
Great. Dr. Noel, let's talk a bit about clinical trials and other research going on. Voss just gestured to that in his comments. I believe you were involved in a clinical trial yourself, and maybe you can tell us a little more about how these studies are informing treatment and recovery and back to work plans for our patients.
Absolutely. I think I want to start by just saying thank you to a lot of the researchers who've stepped up in this time. One study that I myself am enrolled in is the rapid detection of antibodies for healthcare workers and their families. One concern I had when I got sick was that I would infect my husband, and there's no way for him to get tested because he wasn't symptomatic at the time. We quarantined together for 14 days. this clinical trial allowed for not only myself to confirm that I had antibodies, that it wasn't just a false positive, but that he could get tested, and thankfully his test was negative. So there's the future of science. We need to understand who's immune, how does this play out for our communities, and doing the work locally is so important. So I commend the work by Dr. Elliot Bennett Guerrero in that. And then there are the next phase of this is finding out who's immune and who can then donate plasma for convalescent serum. That's my hope in participating in these trials, that maybe my plasma can be of some good to other people.
So maybe you could explain a little bit to our listeners and viewers. On the one side, the antibody tests, what they will enable in terms of who gets to go back to work and under what conditions. And on the other side, maybe using plasma from those like yourself who have developed antibodies. This becomes a treatment modality. So maybe you could explain that a little bit for our listeners and viewers.
Sure. I mean, I'm under the impression that our symptoms should dictate return to work. Right now, we say that if you are afebrile for 72 hours, then that's kind of the marker, and that, there are tests, there are false positives, false negatives, but, being able to determine that your blood, in this case, a finger prick, could determine that you have signs of immunity is very reassuring. And then the next phase is, what does that mean, right? So if I have an increasing IgG or a marker that my immunity is building, do I have some protection? Those are the things that need to be studied further. And so there is that aspect of potentially, yes, you could return to work if you have a certain IgG number, but what if we have an army of clinicians that have some sign of immunity and that we could potentially share that immunity with others?
Right. So, and what we don't know yet is that immunity permanent? Is it temporary? Is it strong? Is it weak? We don't know enough about this virus really to say at present. Is that right?
Yes. And I think that's something that we need to study longitudinally. One thing I'm very proud to say is that not only am I enrolled as a subject, but along with Dr. Lily Mejica Perotti, we have just gotten approved by the RB to do an Oura Ring study. So we are going to be giving out Oura Ring sensors to allow physicians to monitor their own temperature or sleep. And over time, we could see who ends up having COVID and what if they ever get reinfected. So these are kind of important studies that are ongoing, and there are so many to name, but I highly recommend us supporting our researchers in this time.
Yeah, and certainly there seems to be an enormous efflorescence of activity, obviously nationally and globally, but right here in Stony Brook Medicine. Dr. Donnellan, maybe I could invite you in here. I hear this phrase, cytokine storm. I don't know what that means. So maybe you could explain why that's being discussed right now, what its significance is for COVID, and what it tells us about this particular virus.
So cytokines are small proteins that are made in many cells and released from many cells in our system, including our immune cells. And they have a role in response against infection and in inducing inflammation. So when organisms such as the SARS-CoV-2 virus or influenza, for example, reach the lungs, they generate a local immune reaction. And as part of that local immune reaction, there's release of cytokines from the immune cells, and there's been induction of inflammation. But on occasion, especially in people that have particularly robust immune processes, there's an overabundance of cytokines that are released. And so they make what should be localized inflammation into a more widespread phenomenon. And that starts to work against the host. Sometimes we work hard to make sure that they survive that, but it's not always survivable. One of the studies that is being done at Stony Brook is to look at the receptor blockade for interleukin-6, which is one of the cytokines that's involved in this inflammation. And the hope is that we can try to dial back some of that inflammation, that cytokine storm, make it less impactful so as to be able to allow the patient to survive. So that's an important, it was considered to be important back even in the 1918 Spanish flu, quote unquote. And it's certainly noted to be, and it can occur also in seasonal influenza as well as some other infections such as sepsis and whatnot. So it's an exciting area of research, and hopefully it'll contribute to a better outcome in some of our patients.
Could you share with us? I'm sure many of our viewers and listeners wonder, why is it over the past decade or so, right, the proliferation of these new, what seemingly to us are new viruses, right? SARS, COVID, MERS, some with devastating results, and of course, right now we're in the midst of arguably the most significant global public health crisis in history. Why is that happening? How does it happen?
Well, I think for all intents and purposes, COVID-19 is our 1918. Hopefully it's a once in 100 years phenomenon, but we'll see. Many of these infections, if not most of them, actually occur. They start out as organisms that are inherent to animals such as bats, and for MERS-CoV camels, and for SARS-CoV it was civet cats. And when man is in close proximity to animals in their natural surroundings, or when they bring him into artificial areas such as wet markets, as is the case in much of the globe, not just in China, there's opportunities for these viruses that are really quite comfortable in their animal hosts to try to jump ship and see how they do in the human. And most of the time, it doesn't work. They're not adapted to life in a human. Sometimes they have an intermediary, and then from the intermediary, they learn to adapt, as is probably the case, for example, with MERS-CoV, which is probably a bat coronavirus, and then managed to use as an intermediary camels. And so it takes close contact with camels for humans to develop MERS-CoV. For both SARS, the original SARS in 2003, and MERS-CoV currently, the virus has not yet figured out how to easily and sustainably transmit from human to human. And so they're still stuck at that intermediary stage. But somewhere along the way, SARS-CoV-2 not only jumped ship and managed to successfully move from animal to human, but then developed the capability of moving easily from human to human.
Among humans, yes.
Exactly. And that's really, the definition, the most stringent definition of a pandemic is a novel organism, and this is the first pandemic that's ever been not influenza, to which we have no prior immunity, that transmits easily from person to person and spreads globally.
And you mentioned you used the phrase "wet markets" again for the sake of our listeners and viewers. You're referring to these open air markets with live animals that are being bought and sold and
Exactly.
so forth.
Exactly, and some of them are, they wouldn't normally be seen or interact with each other, animals, in terms of being in the same environment, nor would they have common reasons to interact with people. But when you add that whole mix, it's almost like a primordial soup. And then sometimes the conditions are not exactly what you might envision that you would have in a country such as ours, where there's animals are bought and slaughtered at the same time in these markets. And the conditions aren't necessarily sanitary, and they're not necessarily spacious. They're often crowded. And these are opportunities for zoonoses to continue to emerge.
Right. And isn't it true that, for example, HIV, the human immunodeficiency virus, hopped from species to humans? Is that correct?
Correct.
I know that there's been, I heard one report last week that there's been some calls from some leaders in the scientific community that these so-called wet markets be more rigorously regulated or even closed. Obviously, that raises a host of both political, maybe even legal, and certainly cultural questions.
Yeah, a lot of these markets are very culturally embedded within communities, both small and large, and so it's never quite as simple as it sounds like it might be.
Right. So let me turn back to Dr. Noel and to Voss again, just about their experience. I know our listeners and viewers are probably eager to hear more. What would each of you share with given your experience with current COVID patients or those who, of course, are striving to be safe from this disease or even worry that maybe they've contracted it?
I guess I'll go first.
Go ahead, Voss. Go ahead.
And I kind of thought of this as I went through this, that understand.
Must have been terrifying. You must have been terrified.
It was, and I mean, first of all, it's really, really nice, the outpouring of people that want to see how you're doing and how they would ask every day, are you feeling better? Are you feeling better? But what you have to come to realize is this isn't a normal bug that you've gotten before. It's not influenza, and that it's really probably more of a war than a battle. Because, with that second peak that I had when I went downhill a little bit, and I was getting better, it can be very, very discouraging, and it can be very discouraging because most of the other viruses I ever had, I was feeling better within a week. So what I really learned is that you take it a day at a time. It's going to be what it's going to be. You do all the appropriate basic things as we talked about, keeping yourself hydrated, eating, doing good, what's called pulmonary toilet or pulmonary function things to keep your lungs well, and to really take it a step at a time. That really helped me get through it, realizing I can't say, well, I'll be better tomorrow, because, a lot of it's mental, knowing it's going to take some time. And, at the end of the day, there's a very good healthcare system in place to help me if I needed to come to the hospital. But outside of that, I'm doing everything I can.
Dr. Noel?
Yes, absolutely. I would definitely agree with what Voss was saying. And I think an important aspect to this, as we all deal with these chaotic times, is hope, having the understanding that even in uncertainty, we can wish for the best. And then anyone who knows me well will think this is humorous, that I'm the advocate for patience, being patient with oneself and knowing that it is this one day at a time that'll make you healthier and recover faster.
I think we're hearing more and more about this, about self-care. I mean, whether someone indeed has contracted this particular illness or not, just in these very difficult and indeed tragic times, self-care, maybe modulating the amount of negative information you're taking in every day. Avoid the news. You can get your news maybe once a day. Don't saturate yourself with it. Reach out to friends and loved ones. Share information. I think people are learning that takes thought and conscious effort. Otherwise, you'll run the risk of getting quite depressed and upset about what's going on around us.
Absolutely.
And I expect this must be a real issue for all of your colleagues in university hospital, in the clinical setting, in other facilities. Let me invite all three of you. What would you like to say to your colleagues who are waging this battle as you all are every hour of every day?
I would say thank you. I'll be honest with you.
Good place to start.
Because as I said, we've unified. Not that we only was on a team, but we've unified like we've never unified before. And it's not the doctors and the nurses, it's the housekeepers, the respiratory therapists. It's everybody that is going to take care of these patients, obviously taking on the fear, the anxiety of what the virus is, and obviously their own well-being and their family well-being. We've united together, the community uniting around us. Even, I'm sure as you've seen, some of the colored chalk that they've put around the entrances of the hospital with rainbows, thanking, heroes walk through these doors. So it would go on for everyone in the healthcare world, talking to colleagues at Long Island Community Hospital, at different healthcare systems. We're all in this together. The community is behind us. The first responders, our EMS colleagues, our police colleagues, they're all behind us, and the community is. So it's really thank you for the the unified front.
You've touched on something I think it's worth emphasizing. It's the nature of this pandemic. It's the nature of this crisis, that the singular importance of everybody is demonstrated. Because every aspect of the operations of a hospital are basically at the front line. You mentioned, it's not simply physicians and nurses. It's not simply lab technicians. It's housekeepers. It's, facilities operators. It's people transporting the equipment and the supplies that are so crucial to your success. And I think we're seeing that, socially. I think it was 2 weeks ago, the German chancellor, Chancellor Merkel, gave a speech before the national legislature in Germany, where she said our heroes right now in Germany are the truck drivers, the grocery shopkeepers, the pharmacy workers, because they're keeping the wheels going to enable people like all of you, the three of you on the front lines, to care for patients and to try to secure the best possible outcomes.
Truly agree. You go to Stop and Shop, and they're working behind the registers. They have their they have their obviously their masks on.
Right.
There is so many people really working together to provide the essentials of what's required for society to exist, and they're doing it without with dealing with the anxiety and the fear, and they're doing it without hesitation.
Right.
So it really is very heartwarming to see how everyone's coming together.
Dr. Donnellan, Dr. Noel, would you like to chime in on this?
Sure. I think that the healthcare profession now is really in tumultuous times in terms of a lot of anxieties regarding taking on new types of roles, new job functions, and it just is quite amazing to see people step up and support each other. And I think the world is recognizing the importance of public health and healthcare, and that ranges beyond, there are a lot of people involved in making this health system work from the ground up, including our housekeeping all the way to our most senior doctors. And that solidarity is really inspiring. And so I want to thank those people who step up every day.
And I have to say, I echo my colleagues in terms of appreciation for the vastness of the support at every level. I've said this to others before, and I truly mean it. This is not something we can get over. We can't go under it. We can't go around it. We just have to go through it. But I can't imagine wanting to go through this with anyone else and in any other place than my colleagues at Stony Brook and Suffolk County and New York State, and the people from top to bottom who have spent countless hours making sure that we can provide the very best patient care that we can be expected to do. And I'm very, very proud to be part of this team.
Let me draw we have a few minutes left. I want to draw the three of you into a concluding conversation. First about information. What advice could you share with our listeners and viewers about where they should and can turn for the latest news, the latest advice, the latest developments in constructive ways? We know there's a lot of misinformation out there, and I just mentioned a moment ago, we don't want people to overexpose themselves to a lot of negativity. That's not constructive either. But people do want transparent and accurate information. What advice can you give our listeners and viewers about how to remain informed in a productive and healthy way, in all the meanings of that word?
I'll just bring up two sources and obviously let my colleagues comment. Obviously, your primary care doctor, your primary care practitioner, they're very good resources. They're here for you throughout. So, the internet can be an unfiltered source, obviously, as well as the news and other places. So the people that you trust, the people that know you, I've talked to many people who've gotten sick. They've called their primary care doctors. They've helped with the reassurance, and they've helped out. And as far as the internet, I'll be honest with you, the CDC website is incredible. It has a good resource for healthcare providers, for the public, and obviously it's a very well-established resource that people could go to, which I found to be very informative, and I referred, various different agencies and people to look at it because I think it is, one of the more authoritative sites.
Right, internationally recognized as one of the major sites.
Correct.
I would also support, because I've used this myself and referred others, stonybrookmedicine.edu. It has a place for not only the links, as Voss had mentioned, to places like the CDC, which has excellent information for both healthcare workers and not, but also it links up with people who have perhaps they're pregnant and they have questions. It helps them seek out telehealth opportunities. There's a corona hotline for people, not just who are patients at Stony Brook, but those who are concerned that they're having symptoms and wondering if they need to be tested. And there's just an enormous amount of facts without fear, which I think is something that is so important to latch onto at this particular time.
And to dovetail off that, I think the New York State Department of Health resources have really ramped up. They are very transparent with a lot of the data that's coming through, and so I commend those efforts by our Department of Health. And on the other side, in my telehealth world, for any of the clinicians or administrators of the hospital system, looking at the telehealth work aids that have been prepared by teams like Laura McNamara's team and Elisa Betancourt, these laws in telehealth are changing moment by moment, and we have a dedicated army really trying to hone down what these policies mean and how they translate for our doctors. So I wanted to acknowledge that work.
Very important work. One final question for you all, and I know this is not a question you can answer definitively, but it's the question on everybody's minds. Where is this headed? Given the information that you're able to digest so far, and to the best of your ability, fully acknowledging that this is speculation, where do you think we are and when I say we, I'm speaking now of Eastern Long Island, our community, in a month, in 2 months, 3 months? Everyone's wondering, what to expect in the next few months. Do you have a sense? What are you comfortable saying at this point?
Obviously, I'm going to listen to what Dr. Donlan says. She's the epidemiologist.
Yeah, that's right. She's our epidemiologist.
So I would defer to her. But from my perspective, I think we're still very early on in this. I think we've made huge strides by flattening the curve and flattening the infection rate, that our healthcare system is by no means overwhelmed. And we're still functioning, as I said many a time, at a very high level and providing the right care. And I would also echo what Dr. Donlan said earlier on, that all of our administrative social distancing, obviously the things the governor's doing, closing obviously spaces where people can congregate very closely, I think it needs to be continued because this is going to be somewhat prolonged. But I defer to Dr. Donlan.
I think that's a first, Jim. No. Well, I think that it's important for us to not be complacent. I think that for so many people that have felt like they've been at home, they've been deprived of things such as, like, my kids are missing out on their last semester of senior year of high school, so there's no prom. There may not be a graduation or a spring concert. I think people have to just, as my colleagues were saying about getting better from COVID-19, we have to take it day by day. We have to be cognizant that we each have a role in this process to try to get things under control, to hopefully see the numbers continue to flatten and then decrease, and then to understand that normal is going to look different. It's not going to be flicking a switch and suddenly everything is back to the way it was. Things are going to have to gently open up incrementally, and I think it's so important that we have and we continue to work towards increased access to not only testing, but not one that takes a week. So, for example,
Right.
My colleague waited a week for her test to come back, but also a point of care testing, and we're going to have to aggressively also make sure that people are isolating and not flaunting the norms because we want it to be over. Unlike influenza, we don't have antivirals that are readily available. Vaccine trials have yet to be widespread or proven. And this may be something that rears its head again when we all congregate back as a campus when school begins. And so I don't know what the summer's school is going to look like, and I don't know what fall is going to look like for my kids going to college. Are they still going to be at home? It's possible. But I think that we have to trust that we are so much further ahead than where we were even 10 or 15 years ago. And we'll have a lot of lessons to be learned as we go through this.
Yes, and to take a different spin on this as an occupational health doc and preventive medicine physician. I worry a lot about our fellow colleagues. And so I think as we move towards this crisis, just making sure that we're taking care of our own, uplifting each other, and, taking the best precautions to keep ourselves safe. I think that's really important. And
All very important points. We're just out of time. I want to thank Dr. Susan Donnellan, Dr. Kimberly Noel, Dr. Jim Voswinkle for being with us today. A very informative and indeed inspiring conversation. I want to say to the three of you, and through you to all of your colleagues and teammates in Stony Brook Medicine, the work you're doing is widely noticed. I know almost on a daily basis, I'm getting emails and texts from people around the country who are being made aware of what you're doing through news outlets or professional communications. You're celebrated, you're admired, and we're all inspired by the work you're doing. We can never thank you enough, and we wish you every success in waging war against this pandemic. Thank you for being with us, and many thanks to our listeners and viewers for being part of this Beyond the Expected podcast.
Thank you.
thank you.
Thank you.
Okay, we're out.